So how can you get the most from your visit with a GYN oncologist? The first thing I recommend to all patients is that they write down their questions.
It's also important to write that list of questions down before you ever get to the doctor's office.
Because once you get into the office, everything seems to disappear and it's a blank.
Because as soon as the doctor walks in, most patients forget everything they wanted to ask.
When going to a gynecologic oncologist or any provider, it's important that they come with all their questions, that they take the notes, that they follow the instructions, they follow the directions.
How do you come up with a list of questions to ask the doctor?
There's a lot of information out on the internet on what to do if I'm recently diagnosed with a cancer. And it's somewhat difficult to always sort through that information to know what I need to bring to my physician, what questions I should be asking.
I think probably the most important thing is looking for sources of knowledge that are reputable and reliable. We can get a lot of scary things off of the internet. We all know that. But there are websites that are filled with good, true knowledge about GYN cancers.
The National Cancer Institute does have a website.
Cancer.org, Women's Cancer Network, WCN.org. Those are very, very good websites that can give you information from which you can come up with a list of questions to ask your doctor.
When you're talking to your physician, being as much educated as you can about your disease is certainly helpful.
And if you go to a gynecologic oncologist, there are certain questions that you should ask. Obviously, what is my exact diagnosis?
What therapeutic options do I have? Can surgery be done in a minimally invasive manner? Is surgery appropriate, or are there other therapeutic options that I have, such as radiation, chemotherapy, biologic or hormonal therapies?
And to ask what are the side effects associated with these therapies. Patients should also understand what they should expect following treatment, what the follow-up should be, and what they should be looking for recurrence.
Some questions that you can ask the surgeon to figure out and determine whether this is the surgeon for you are, well, how many of these do you do on a monthly or a yearly basis? What kind of complications have you had or can I expect?
I feel, and I'm sure most of my colleagues feel, that we're there to provide information for the patient. So all questions are good questions.
And if the physician is offended by those questions, then that may be an indication that there is not a good level of trust. There's not a good doctor-patient relationship. It may also indicate that that physician is intimidated, doesn't feel comfortable in their job and in their skill and in their knowledge.